Vaginal discharge is a natural and essential part of female reproductive health, yet it often remains a topic shrouded in mystery or embarrassment. Understanding what constitutes healthy vaginal discharge and what might be cause for concern is crucial for maintaining well-being and feeling empowered about your body. Let's break down the basics of vaginal discharge, explore its normal variations, and discuss signs that may indicate an underlying issue. Vaginal discharge is a fluid produced by glands inside the vagina and cervix. Its primary function is to carry away dead cells and bacteria, keeping the vagina clean and helping prevent infection. Most women will experience some form of discharge throughout their lives, and its presence is entirely normal. In fact, noticing changes in your discharge can be a helpful way to tune into your body's health and recognize when things might be amiss. Healthy vaginal discharge varies from person to person and can change throughout the menstrual cycle. Typically, it ranges in color from clear to milky white and may have a mild scent. The consistency can shift from thin and watery to thick and sticky, depending on hormonal fluctuations. For example, during ovulation, when estrogen levels are at their peak, discharge often becomes clear, slippery, and stretchy, resembling raw egg whites. This consistency helps sperm travel through the cervix, playing a vital role in fertility. Outside of ovulation, discharge may be more creamy or opaque, especially in the days leading up to menstruation. After your period, it might decrease in volume and appear drier. Pregnancy, birth control, and breastfeeding can also alter discharge patterns due to shifts in hormone levels. These variations are generally harmless and reflect your body's natural rhythm. It's important to note that healthy discharge should not be accompanied by itching, burning, or an unpleasant odor. If you're experiencing these symptoms, or if the discharge suddenly changes in color, volume, or texture, it could signal an infection or another health issue. Let's look at some common causes of abnormal discharge and what you should watch out for. One of the most frequent causes of unusual vaginal discharge is a yeast infection. This type of infection occurs when the balance of bacteria and yeast in the vagina is disrupted, often due to antibiotic use, hormonal changes, or certain health conditions. Yeast infections typically produce a thick, white, cottage cheese-like discharge and may cause intense itching, swelling, and redness. Another common culprit is bacterial vaginosis, which results from an overgrowth of certain bacteria in the vagina. Discharge from bacterial vaginosis is usually thin, gray or white, and often has a strong, fishy odor. While it may not always cause discomfort, it's important to seek treatment, as bacterial vaginosis can increase the risk of other health problems. Sexually transmitted infections, such as chlamydia, gonorrhea, or trichomoniasis, can also alter vaginal discharge. These infections may cause yellow or green discharge, often accompanied by a foul smell, pain, or irritation. In some cases, the discharge may be frothy or contain pus. If you suspect you have an STI, prompt medical attention is essential for both your health and the health of your partners. Less commonly, abnormal discharge might be a sign of more serious conditions, such as pelvic inflammatory disease or cervical cancer. If you notice blood-tinged discharge outside of your menstrual cycle, or if the discharge is accompanied by pelvic pain, fever, or unexplained fatigue, it's crucial to consult a healthcare provider. Other factors can also influence vaginal discharge. Stress, changes in diet, certain medications, and personal hygiene products, like scented soaps or douches, may all affect the amount, color, or consistency of discharge. While it's tempting to use products that promise freshness, the vagina is self-cleaning and typically doesn't require anything more than gentle washing with warm water. In fact, using harsh products can disrupt the natural balance, leading to irritation or infection. So, how can you tell what's healthy and what's not? The key is to know your own baseline and pay attention to any changes. Healthy discharge should be clear or white with a mild scent and shouldn't cause discomfort. Some variation in consistency and amount is normal, especially during the menstrual cycle, pregnancy, or hormonal shifts. If you notice any of the following, it's a good idea to reach out to your healthcare provider. A sudden change in color, such as yellow, green, or gray discharge. a strong, unpleasant, or fishy odor. Itching, burning, swelling, or redness. Discharge that is thick, clumpy, or frothy. Blood-tinged discharge outside of your period. Pelvic pain, fever, or other unusual symptoms. When speaking with your provider, be prepared to describe your symptoms clearly. Mention when the changes began, any accompanying symptoms, and any relevant medical history, such as recent antibiotic use, new sexual partners, or changes in contraception. Your provider may perform a physical exam, take a sample of the discharge for testing, and recommend appropriate treatment if needed. In most cases, abnormal discharge is easily treated once the underlying cause is identified. Yeast infections, for example, are typically managed with antifungal medications, while bacterial vaginosis requires antibiotics. Sexually transmitted infections may need more specific treatment, and your provider will guide you through the process. To help maintain healthy vaginal flora and reduce the risk of infection, practice good hygiene by washing with water only and avoiding douching or scented products. Wear breathable cotton underwear and change out of wet clothes promptly. If you're sexually active, use condoms to lower the risk of STIs and get regular screenings as recommended. Remember, vaginal discharge is a sign that your body is functioning as it should. Rather than being a source of embarrassment or worry, it's an opportunity to connect with your body and notice changes that might require attention. By understanding what's normal and what's not, you can take charge of your reproductive health and seek support when needed. If you ever have questions or concerns about your vaginal discharge, don't hesitate to talk to your healthcare provider. Open communication about your health is the foundation for well-being, and no question is too small or insignificant. Your body's natural signals are there to help guide you. Listen to them, trust them, and feel confident in caring for yourself. In summary, healthy vaginal discharge is typically clear or white, varies in consistency, and has a mild scent. Changes in color, odor, or texture, especially when accompanied by discomfort, can indicate infections or other medical issues that may need attention. By staying informed, practicing good hygiene, and reaching out to your provider when changes arise, you'll be supporting your health and well-being every day.